Hi, my name is Amanda King, and I designed a clinical trial for the elimination of HPV precancerous cells through nanoshells and quantum dots. Nanotechnology is really important in the cancer world because it is specific and it does not hurt other body functions, whereas previous chemotherapy does hurt other body functions. Patients being studied are those who have HPV and a high risk for cervical cancer, but do not have the cancer yet because we are trying to get rid of precancerous cells. There are no known risks, but there is a possibility that the injection will pass through the body too quickly and it will not be effective, or the target cells or the nanoshells will target cells with similar DNA sequences, which will destroy healthy cells. But that's not very likely. There's also the possibility that the nanoshells will heat up too hot and cause damage to the surrounding healthy cells. The destruction of precancerous cells is a known benefit, which will eliminate the need for cryosurgery and the possibility of the cancer progressing. This treatment will be administered via intramuscular injection in the arm with a serum that will contain nanoshells. A couple of hours will be allotted for the treatment to reach the cells, and then patient will be exposed to near-infrared light. This light will heat up the cells, or the nanoshells, and it will kill the cancer cells. And then quantum dots will be injected, and UV light will be shown on the patient, and then that will show the remaining precancerous cells to see how effective the treatment was. These nanoshells will have antibodies linked to them that will target cells that code for precancerous antigens. The nanoshells will locate the antigens and allow the nanoshells into the cell. The treatment will stay in the cell until the patient is exposed to near-infrared light, which will kill the cell, because the nanoshells vibrate. The gold will vibrate in response to the light, and it will heat up too hot for the cell to handle and cause permanent damage. Quantum dots will then be injected into the patient to see the effectiveness of the treatment. Now, these quantum dots will go into the cells that code for cancer, and they will light up. They don't do any damage, but they will light up when exposed to UV light so that we can see if any precancerous cells are missed. The goal of this trial is to kill precancerous cells that are caused by human papillomavirus. Our hypothesis is that the nanoparticle technology will remove all cells that have the DNA coding for cancer without destroying surrounding healthy cells. This will be more effective than current treatments like chemotherapy because it will target cells more efficiently, it will not hurt cells that are healthy, and it will not have major negative effects on other body functions. Whereas chemotherapy, which is also a drug that targets cancer cells, it does not target direct cancer cells, but it targets fast reproducing cells that could be cancer. So it has a major negative effect on other healthy cells that reproduce faster, like hair and nails. And it also kills healthy cells as well that are near cancer cells, so that is not helpful at all. And it has major negative effects, and it deteriorates the body's functions because it hurts the immune system, it hurts the integumentary system, the cardiovascular system. It just is not very helpful. This trial design will be double-blind, where Group A will receive the nanoshell treatment and then near-infrared light to complete it, and then quantum dots will be injected to determine the effectiveness. Group B will receive a placebo, which would be normal chemotherapy. And then an injection will be followed by placebo light, and then quantum dots to determine efficiency. There will be 4 phases of this trial, and they will include phase 1 with 50 volunteers. They will be split evenly into Group A and Group B, and phase 1 will help us determine dosage range, safety, and some side effects. Phase 2 will add 100 new volunteers, which will then be evenly split into both groups. This will help sharpen the dosage, sharpen the safety and side effects, and sort of determine a basic effectiveness of this treatment. Phase 3 will have 2,000 people, and this will help us know specific side effects and effectiveness so that it can go on the market. Phase 4 will be on the market, monitoring thousands of users, and this will help determine risks, benefits, and optimal use for further use. The selection of subjects, those with HPV, high risk for cancer, are healthy, and between the ages of 20 and 50 are needed for this trial. If they're younger than 20, it may cause health problems. If they're older than 50, their immune systems may be deteriorating and not able to withstand this trial. Those with heart problems, immune disorders, cervical disorders, or cancers of other kinds may affect the trial results. And those with disorders that will be triggered due to near-infrared light or ultraviolet lights will also not be selected, like those with seizures, those with skin disorders that are sensitive to light. That will compromise the safety of the patient, and we do not want that. Before signing up for this clinical trial, patients will have to go through normal testing of the blood, testing of the mental health, physical health, to see if they are able to go through this trial and not compromise their safety. The one especially needed to be healthy is the white blood cell count, or the leukocyte count. This range is normally between 4,300 and 10,800 cells per cubic millimeter of blood, and this is important because we're putting extra nanoshells or foreign objects into the blood, and if the white blood cell count is too high, it'll go out of the body too quickly, and if it's too low, then it may cause more immune disorders and sicknesses, and that wouldn't be good. Height and weight will also be considered to determine a safe dosage for each patient. Thank you.